Okay. Hello, everyone, and welcome. I will introduce myself first, and then Kevin will take over, and he will introduce himself. He will tell you a little bit about him, and then he will hopefully bring up his PowerPoint. He will go through the scientific ways of what Boswellic acid is all about. And then he will hand it over to me, and I will show you how to use it, to actually use it. And also, I will show you how it was used by the testers that did it, that tested it for me. I am Robin Kessler. I am a clinical aromatherapist. My specialty is working with hospice. I also am the board trustee to IFPA, and I am a clinical member of NAHA and a professional member of AIA. I have written many articles on aromatherapy and frankincense in many magazines, and I run a Facebook group called Frankincense Resins and All Tree Resins, and there's a wealth of information in there. The book that I wrote was basically because I wanted an alternative way other than using just essential oils. And so I researched and I spoke to farmers and I worked with those in the industry. And then I decided to do research on the Boswellic acid. And after all the research that I did and realized what it is and what it could do, it's just amazing. And then I did a seminar for our Canadian Institute, and that's how I found Kevin. And then Kevin and I have been collaborating together. We're working on projects together with the BA, and he's been working on this for a very long time. So what's going to happen is he's going to go through his presentation, and then we will stop a minute to give him a chance to come out of it. And then I will continue with mine. And then if you have any questions, write them down now, and we might answer some of them. And then you can ask afterwards. Okay, Kevin, before you share your screen, let's hear about what you are and what you do.
All right, let me put on the PowerPoint.
Well, not yet.
Sorry?
Tell us about you first.
Sorry?
Tell us about you. Give me a bio of you.
Oh, it's shown in the first slide.
No, it's on the first slide. All right, then put the PowerPoint on.
Let's share.
Click on share.
Yeah. Screen number 2. Can you see it?
Not yet.
Did
you click on it?
I put share, but
Well, you have to find the PowerPoint presentation.
I got it here. I got screen 1, screen. Oh.
There you go.
Oh, you got it now, huh?
We got it now.
Okay. Now, let me bring it over.
And please make sure you're muted. He and I are the only ones that should be unmute.
All right, can you hear me?
No, you got to move it over to the other screen. You had it fine the first time.
Okay.
That's it, right there. Stop.
All right.
All right.
Okay, let me start.
Go ahead.
To all my friends who come on board this evening, I just like to thank you for sharing with me the passion that I have for frankincense and Boswellic acid for the last 20 years. Together with Robin, who has been in the business for nearly 20 years, and mine is about 25 years. So both of us put in nearly 45 years of our life in this. As for myself, I have been more of an academic, medical doctor, and research scientist. When I came to America in 1981, I was asked to develop a department of clinical pharmacology to study the newly developed drugs by the big pharmaceutical companies. And that's where my journey started in the America. Now, what I like to talk this evening is about the benefits of boswellic acids derived from the raisins. A lot of people mistook that the boswellic acid comes from the essential oil. No, the answer is no. Now, this is the history of myself spread over nearly 60 years. In my younger days, I was a young doctor taking care of a patient in the medical ward. One patient came in with diarrhea, and I took the stools out, looked under the microscope. I found amoeba, a parasite moving. At that time, the only treatment was an alkaloid derived from the ipecac plant, originated in Brazil. Ipecac plant was used as a tincture to induce vomiting in people who swallow poison or anything of the sort. And because of that incident, I took upon myself to go into the research why the patient treated and nearly died from it. So I found that chemicals actually work on the nerve. And I was very proud of it. I explained why patients can have severe low blood pressure when they take this pill. Next, I went to London around in late 60.
You
I
guys are
was,
getting infected with that weird thing.
sorry?
Please mute. Please mute. Thank you. Go ahead.
I was in London at the right time and the right place and with the right person. There I worked under Sir John Vane, who in 1982 was awarded the Nobel Prize for his discovery of how aspirin stopped the synthesis of some chemicals that cause inflammation. And under his guidance, I discovered the enzyme that convert the inactive compound into a highly active compound in the circulation. And that enzyme was found to be present in the lung. And following that, my friend from Brazil came in with a sample of poison from the snake. And at that time, he found that venom from the snake was able to potentiate some of the toxic effects. So we worked together. I said, let me have a sample of your stuff and see how it works. And I found that blocked the conversion of an inactive compound to the active compound. And that was the beginning of the ACE inhibitor. And the drug company took over my project, and in about 11 years came up with the first ACE inhibitor called captopril or capoten. Now, then I came to America in 1981. I was supposed to build a department helping the pharmaceutical companies to study the toxic effect on volunteers and on selected patients. Then my research grant went out, so I had to come out and take care of myself and my family. So I went into private practice. That was the year 2008. At that time, I continued practicing for a couple of years, but I felt the private practice, it's quite mundane because most of the time I treat patients with overweight, diabetes, hypertension. All these are simple medical problems that I could solve easily. So I asked myself, having developed and having pioneered in the development of a new drug, what else can I do? Then I turn on to food, because food is the basic thing that causes all the problem. If you eat the wrong food, they say you are what you eat. For example, if you eat too much oil, your whole body will be saturated with the fatty acid. And there are two kinds of fatty acids in the food that we eat, the good and the bad. If the bad ratio is higher than the good ratio, then you are deep in trouble. Then we go back to the paleo diet in the olden days. They found that people who eat the paleo diet have a ratio of omega-6 to omega-3 20 in the people who eat a lot of fat, usually it's 20:1, whereas the ideal ratio should be 2:1 and 1:1. And having known that about 30 years ago, I changed my diet completely. My cholesterol was very high at one point, and then the omega-6 was bad. So my whole body was burning, inflamed. I said, no, that was not a good thing to do. So I changed my diet completely, and now I take no drug. My cholesterol is fantastic, blood pressure is fantastic. So I took upon myself that food ultimately is the answer to most of the medical problems. Now, so I retired in 2012, devoting full time into research on food as medicine and pain mechanism. Because just before I retired, old lady was referred to me how to manage her low back pain. She was given a script that cost her more than $500. And she told me that her social security check is less than 250. She was in tears. So I found that capsaicin patch should be simple, should be easily available. So I started to study what natural chemicals can stop pain. And that led me to boswellic acid and frankincense. Now, boswellic acid is a compound extracted from the frankincense. So this is the outline of my talk tonight, the boswellic acid, the traditional use of frankincense, the modern use of frankincense, and inflammation. This is what I want you to take home the message about inflammation and how boswellic acid can affect it. Now, all of you are familiar with the story that when Jesus Christ was born, 3 wise men came from the east, all of them carrying some gift for the infant Jesus Christ. When they arrived at the Nazareth, the gift given to Jesus Christ was gold here, gold, frankincense, and myrrh. Now, what is frankincense? I was wondering. At that, many years ago, I was courting my wife. And my mother-in-law at that time fumigated the whole house with the frankincense incense. So I asked her, I said, Mom, what is this good stuff? She was trained as a Swedish deep tissue massage. She cured a lot of people simply by using natural herbs. That is how I got interested in the herbs and spices and so on. So she told me that, well, these are wonderful stuff. If anything given to Jesus Christ, it must be good. So at that time, there was no science at all. Nobody could tell me anything about it. Now let's talk about the frankincense. Now, frankincense is a resin or gum derived from tapping the sap from a tree called Boswellia tree. When you cut the bark off, this sap will flow out, and then it solidifies into a resin. Now, these Boswellia trees are grown in different parts of the world, stretching from West Africa to India. So many varieties of trees are available. The resin that I found the most are the Boswellia carteri and Boswellia sacra. Robin will tell you more about it. My mouse is very slow.
Next slide.
Yep. My, okay. Yeah.
There you
There
go.
are, of all the Boswellia trees, there are only about 7 or 8 of them that give you the resin. Now, what is the composition of the Boswellia resin? It has a volatile oil, which makes up about 15% of it. It has a resin, which makes up about 50 to 70%. But the boswellic acids is anywhere between 10 to 40% or 30 to 35%. So the concentrations of these bioactive ingredients varies from one location to another locations. Now, if we extracted this boswellic acids, you find that there are more than 200 phytochemicals inside. It could be divided into 3 portions. When you distill it, you get essential oil. And from the essential oil, you get the small molecules that give you the aroma, the smell. Then there's another one called water-soluble compounds. They are mainly the flavonoids and the glycosides. Now, what I am interested tonight is to discuss the boswellic acids present in the resin. Now, there's about 6 boswellic acid compound present in here. The one that has been most actively studied scientifically is called AK boswellic acid. This is the one. Now, what is the traditional use of frankincense? They are used mainly for religious ceremony in Egypt, in Greeks, in Rome, and various religious like Christianity and Judaism. It also has been used widely for a few thousand years by people in Egypt, Africa, Middle East, India, and China. And of course, because of the fragrance and the aroma, it has been widely used in Egypt. Now, what about modern use? People use it strictly to prevent pain, to prevent or to lessen the inflammation. So this is an important message for tonight. Boswellic acids are anti-inflammatory compound. They act exactly like aspirin or like ibuprofen, but they act differently from Tylenol. Tylenol reduces the fever, but it has got no anti-inflammatory property at all. So if you have inflammation caused by trauma and so on, Tylenol only relieves the pain on in the brain. It has got no effect to reduce the swelling in the area of injury. Oh, my mouse is a bit sluggish. Okay, this tells you how the medical or scientific community look upon the boswellic acid. Nobody studied anything below 1970, but it was only in the last 20 years the scientists and the doctors are beginning to realize that there is something there. We need to look at it. So since most of the boswellic acid or the extract were used for arthritis and so on, so the problem is that they were trying to reduce the inflammation in people who take this. So now this leads us to the next question. What is inflammation? In simple language, what it means is set on fire. And the observations were made by Celsius, the person who discovered the mercury thermometer. He described inflammation is characterized by four the signs: pain, swelling, redness, and warmth. Later on, we shall add another sign into this. So inflammation is called inflammation results in all this problem. The question is, what caused this? What caused this? Now, this is a simple illustration showing that the natural history of infection. First, suppose you get a prick here. What happens? There's a swelling here. There's a pain. There's warmth, and there is also redness. And let it go on for a couple of days. You get pus. When you lump the pus come out, the wound heals by itself. Now, what we doctors are interested are what causes pain, swelling, redness, and warmth. What causes? Now, in the olden days, we don't know anything about it until the microscope came into being. And then biochemists come in, pharmacology come in. So all these new disciplines combined together show that inflammation has a pharmacological basis, and we prove it by drawing the blood in case you get a pneumonia or cold or fever. And when you draw the blood out and spin it up, you have three sections: the plasma, the white blood cells in this area, and the red blood cells here. Now, it is in the white blood cells here you find there's a tremendous increase of the white blood cells from maybe 5,000 to over 20,000, 80,000. All these are inflammatory cells. Then in the plasma, we also find a lot of chemical mediators. So to put it into simple language, this is what actually happened. When there's injury, there is an explosion of inflammatory mediators. The name is mediators, and this can be found in the plasma here. Now, what do these mediators do? They sensitize your nerve. They cause pain. They make the pain receptors activated, and that send the signal all the way up to the brain. Now, it was only in the last few years that the pain receptors have been discovered at the nerve endings. And this is where my main interest has been over the last 15 years. I found that a lot of chemicals in the essential oil can be used to block the receptors here so that the pain can be reduced. So I'll talk about it in another lectures. Now, if you look at the modern concept about inflammation, first, when there's injury, with the injury, you have a tissue damage. When the tissue is damaged, you get a host of chemicals, all this. And then from the plasma, you get a bradykinin. This is where I want you to remember. Now, all these chemicals sensitize your nerve endings. It sends impulse to your brain telling you that there's some damage to the skin. You need to avoid it. Now, what doctors have been doing over the past 2,000 years, just about 100 years ago, it was an Italian scientist who found that histamine is one of the chemicals that cause pain. So they came out with the antihistamine. It is now called Benadryl. Now, if you treat the pain with Benadryl, you neglect all the other compounds. You still get a pain. So it was not an ideal agent. Then next comes prostaglandins and leukotrienes. Now, my mentor was the one who discovered that aspirin blocks this pathway. I'll come to that more later on. Then what about the others? The others also, we doctors have no means to block it, to give you 100% pain-free environment. And as we study this inflammation more and more, we found that there is another group of substance, we call it cytokines. These cytokines draw the white blood cells into the site of inflammation, and then they stimulate the pain receptor and cause pain. So you look at this whole area here. We doctors are not very smart after all. We only could block, as of today, we could only block the histamine, we could block the prostaglandins. We have no means to block leukotrienes yet. So this is where I want you to remember that aspirin works only at the prostaglandin level. It has no effect on this. So this is where tonight I want you to remember that the boswellic acid act as a blocker for this. At least now we have something better to talk about. Yeah. Now, looking at the aspirin, how it works here, this is an illustration. When the tissue is damaged, arachidonic acid, which is bad fatty acid, omega-6 acid, when it is activated, the two enzymes come in. These enzymes are liberated only when your tissues are damaged. It first produces prostaglandin, and then the other one produces leukotrienes. Aspirin works here. So this is left untouched. Now, when these enzymes are liberated at the damaged area, they are actually enzymes. They convert the inactive substance into very powerful painkiller. Now, the question is, what is an enzyme? And an enzyme is liberated, for example, from the tissue damaged tissue cell is liberated from your blood vessels, liberated from the smooth muscles, liberated also from the nerve endings. Now, arachidonic acid is the source of all the chemical mediators. What it does is get into the enzyme break it up or convert it into something very active here. We call prostaglandin and leukotrienes. Now let's talk about the first enzyme called COX. COX enzyme convert this arachidonic acid into a series of prostaglandins. They are called prostaglandins because these chemicals were originally found in the prostate fluid, semen from the man, and they're called prostaglandin. When this arachidonic acid, which is bad fatty acid, omega-6, when it is activated, it produces all this. So it produces inflammation. It causes a contraction of the uterus. It causes dilatation of the blood vessels and so on. Now, aspirin, since aspirin works so well in this, all the pharmaceutical companies start making synthetic stuff. So aspirin and the non-steroidal anti-inflammatory drugs are synthetic stuff. But then they found that if you put aspirin, give patient aspirin, they are prone to develop stomach ulcer. So the pharmaceutical companies came out and said, hey, let us develop some chemicals that would protect the stomach from having ulcers and bleeding. That comes the selective COX-2 inhibitors. When this was marketed in the late 1990s, I was so fascinated. I said, well, we have a good medicine. We can do a lot now for patients. But unfortunately, after 3 to 4 years clinical usage all over the world, we saw more patients have a stroke, more patients have a heart attack. So the warning came out from the professional organization bodies saying that do not this, and FDA has now banned 2 of these selective blockers, leaving the Celebrex as the only one. You can use it only for a short time. So this is the story about how aspirin behave good, bad, and ugly. Now we go to the next enzyme. Now take together what prostaglandins do is it has a very wide spectrum, and if you're a doctor, you should be aware of all this. The prostaglandins are responsible for the pain, for the inflammation, for even platelets clotting mechanism. This is why aspirin is used to prevent blood clot, and to prevent people from having heart attack or a stroke. Now, the other enzyme is called 5-LOX. This is the enzyme that has been neglected for 70 years. Now, when the when this discovery was made, the pharmaceutical company jumped the gun. They tried to make a synthetic stuff. The first antagonist to that is called xylitol, which is almost the equivalent of aspirin. Again, clinical studies show that they cause toxic effect on the liver, so that was taken down. But then I came into the scene. I tried, hey, why don't we use boswellic acid? This will give us a natural compound with very little side effect. Now, the products of this enzyme is that it causes pain. So if you could block that enzyme, we could reduce the pain, and it could also enhance inflammation, and it can cause contraction of the lung muscles. Like asthma is probably due to that. But so far, that medicine did not help much, and a lot of studies have been made with boswellic acids, and the studies show that boswellic acid work just as well, if not better than the synthetic stuff. Now, then the next question is for doctors and scientists to ask. There are so many boswellic acid. Which one is the most powerful one? The one that is so far has been found to be very effective is called acetyl keto boswellic acid. This is the most powerful one. Now, taken together, this is the message I want you to take home. Now, for the prostaglandin, you can use aspirin and the non-steroid medications to block it here. But as for the 5-LOX enzyme, you don't have anything except boswellic acid. So the question is, I have to go deeper into what is boswellic acid all about. Now, the recent studies show that boswellic acid not only blocks the pathway, it also has some property to block the aspirin. I say, wow, this is fantastic. This is better than any synthetic drugs available in the market. So I have been working on this, and I give you some result later on. Now, this is the summary of how boswellic acid works. It can work by the COX pathway, and it can also work by the 5-LOX pathway. Now, what studies have been made with this boswellic acid? Let's go back to the beginning. And from the Frankenstein, we get this biomass after distillation, the boswellic. And this is a mixture of several boswellic acid. The most potent one is Akbar. Now, what do they do? They are very powerful anti-inflammatory agent, and because of that, they also provide very powerful pain relief property. Now, studies have been made in many medical conditions, but not in big trials, but in small trials, and all show that the boswellic acids have the property to reduce pain, swelling, warm, and so on. All of them. Now, of all the boswellic acids, again, Akbar is the most powerful one. How does the boswellic acid act in the body? So if you ingest the boswellic acids, it gets into the white blood cells. The word leukotriene. Leukotriene comes from the word leukocyte means the white blood cells. That the boswellic get into the white cells and it block this enzyme in the production of leukotriene. That's how we get the relief. Now, besides that, their actions on the enzyme, the boswellic acid also has anti-cancer property. It also has a property to prevent the blood clotting, just like aspirin. Now, what are the clinical trials? The clinical trials have been focused on how to stop the pain, how to reduce inflammation, and how you can knock off the cancer. this is a summary of how Boswellic acids work on the immune system. I won't go into detail into this, but just to say that one of the property of the Boswellic acid is that it stabilizes the mast cells. Mast cells are the culprit for asthma. People with asthma, because from mast cells, a lot of chemicals are released, and that causes the constriction of your lungs. Now, this is another interesting story here. Just only about a few years ago, doctors found that the triple negative breast cancer is resistant to almost all kinds of treatment. There's no chemo for that except surgery, radiation, and therapy. But when they do the test in the test tube, they find that this is a very powerful agent that stops the cancer cells from spreading. So I'm looking forward to more work to be done, and I'm looking forward to a pure Boswellic acid that we can use clinically. Now, will the Boswellic acid reduce weight? Will it lower the blood pressure? So studies show that the Boswellic acids reduce the blood pressure and reduce sugar in people with diabetes, and reduce the cholesterol in people who are obese and so on. And ultimately, it has the property to lower the weight. A lot of people didn't know about this, but when I look into the literature, that there is a lot of potential there. The Boswellic acid, if used properly and if it's absorbed properly, it has the property to bring down your body weight. And the nutraceutical companies are very excited about this.
Good.
Yeah. My
Yes,
mouse is very slow. Oh, it should be coming on.
go down to the next one.
Oh. What's wrong with that? No, never mind. I use manual. Okay, manual better. Okay. Now, another thing that interests me most lately was that Boswellic acid taken by mouth is not very well absorbed. The absorption may be 30 to 50%, but you enhance or increase the absorption of the Boswellic acid by using a small dose of a black pepper extract. Now, in the animal studies, a lot of studies have been made for animals with arthritis, horses, dogs, and the cats. Okay, so dog, and then the evidence that it works as an anti-inflammatory agent is that it brings down all these cytokines level from here to here, from here to here, and from here to here. Very, very effective chemical that lowers the inflammatory mediators. This is the basis of how Boswellic acid can reduce inflammation. Now, what about human studies? Oh, not much, but there are quite a lot. No, now this is the slideshow that I took from my wife when she slipped on the floor and hit her flank against the side of the table. She was in severe pain on that day, and I just happened to make some extract from the frankincense biomass, and I put a little bit on it. Within 5 minutes, she said, the pain is gone. I said, miracle. Thank God for that. Now, following that, I tried on some other cases, and they are very, very good. So Boswellic acid become a very good topical painkiller. I call it topical painkiller. Now, there are many other studies that confirm my observation. Now, this is And one study, a randomized control, double-blind study showing that people who take this, this is an extract, unfortunately, it's an extract of turmeric and boswellia. Now, another study also proved that boswellic acids are very effective in reducing the pain. Now, clinically, it has been done in isolated instances. It works very well on asthma, inflammatory bowel disease, and pain, and the metabolic like diabetes. It works very well, and cancer. All these have been done on the test tube. Only one study was done on a patient with the brain tumor. Then the others. So there are many indications that boswellic acid can be used medically. The overall, boswellic acid reduce the pain in arthritis. One case, a brain tumor, seems to respond very well to that. And a skin disease, diabetes, and asthma. Now, my summary is that just to show you that the boswellic acid is the extract derived from the biomass after they remove the essential oil and the hydrosol. Now, so at this stage, I can say that the scientific studies are very limited at this time, but I look forward to more studies on this. So I yield the floor to Robin, who will talk more about how to use the boswellic acids. Robin,
All right.
You can take over the
Yes.
floor.
Take your share, unshare, so I could share, please.
Okay.
Remember, it's on the bottom.
Hey, wait a second too. Oh, there.
This is what happens when you work on two separate screens in front of you.
Let me check it out. Let me check it out again. Wait a second too. Where's the bottom?
On the bottom.
Yeah, I missed it. I don't know where it is. Oh yeah.
I
Stop,
know,
yeah.
last time you had difficulty
share.
trying to
Okay,
do.
it says here. It says here. Stop.
Yeah, stop the share.
Yeah. Got it.
Go ahead.
Okay. Thank
Okay,
you.
so let me share mine.
Hmm.
Okay. Everybody see me? Kevin, you see me?
Yes.
Okay, because I only see you now.
Hmm.
So I'm gonna go through how to use it. And I've been testing it with testers for about 2.5 years. And I've been using Sacra BA, and I'm gonna call it BA because it's easier. I'm gonna using Sacra BA and also using Qatari BA. And I'm going to show you basically how it's being used, and I'm going to show you some testimonials. So how it's being used is in a lotion, in a carrier oil, or in capsules. And I'm going to go through the Qatari because we've been using that more at this point than the Sacra. And we came up with two types of Qatari, which is the raw Qatari, which is right after distillation. And then I'm working with a company in the Netherlands, and we developed and using an organic ethanol solvent, which is basically around 70% Boswellic acid has been pulled out. The powder itself looks like this. Can you see? Kevin, tell me if you can see the powder. Because I can't see myself.
Yes, yes.
You see the powder? Okay,
Uh-huh.
so the powder looks like this. This is the BA raw, and this is the BA 70%. There's a little difference in the color because this is the 70%, and the 70% is a much finer, just like baby powder. And the raw is a little bit thicker, just a tiny bit thicker because it's raw. So as you can see, it's still fine, but not as fine. And when they use the ethanol alcohol, that's what makes it even more powder. And with the 70%, just so you know, when it's done with an ethanol solvent, and it's an organic solvent, it actually has very little smell and very little taste. And the one that is the raw has a nutty frankincense type smell and taste. The advantage of the 70 versus the raw is, number one, the boswellic acid is higher, and number two, it completely melts. And I put it in fractionated coconut oil. Let me take the label off so you can see it better. And you could see all you see is the fractionated coconut oil. It completely melts in the oil. And it doesn't matter what carrier oil you use. It has no taste and it has no smell, but it's very, very strong. And I'm going to go into a little bit more about it later on. You also can use it. Oh, wait a minute. Let's get to the first one. In different applications, and I went to the wrong slide first. So as you know, it comes from the aftermath or the after boil, and it's at the bottom of the still. And when it comes out, it looks just like this. It is a hard mess. And then it is ground down, and when it's ground down, it looks just like this. Then it's dried, and it's dried into a fine powder that looks just like this. And as you saw with the raw, it's just a little darker than the 70%. What you're seeing in that picture is actually the 70%. As Kevin told you, it's too heavy a molecule. It does not pass through in the essential oil or the hydrosol. So if somebody says, I have BA in my essential oil, and it doesn't pass through the CO2 either, it stays behind. Boswellic Qatari resin that is used comes from Somalia, and it's first grade. Boswellic Hajari Sacra is also a mixture of different resins, and that comes from Oman. And I just want to show you the same thing. These are the molecules, but how people say, well, how do you know what's in it? Well, it's tested by what is called a standard machine. Very similar to a GC report, but in a GC report, they're doing a liquid compound. With this, they can't do liquid because it's an extract, it's a powder. So you can't put it into the GC machine. So it's done with a measurement called a standard. And when it comes out of that machine, it gives you all the percentage here. And when you add this up, you get the total AKBA. So you can see all the different components that are in here. And when it's all added up, all these figures are add it up, and that gives you the total Boswellic acid in whichever one was used. A study was done, and we actually have this study in the frankincense group. So if you go in, you can see it there. And this was done against a treatment resistance of breast cancer on a patient. And but we don't know what the results were because it was actually, there's no other paper but this, so we don't know if it actually worked. These are the resins that have, this is resins, not powder, that have the highest percentage of Boswellic acid in it. Dalzelli, which has the highest percentage, is a very hard resin to get because the tree does not produce the resin more than once a year, if that much. So it's very, very expensive. And to make it into a powder, they couldn't sell it because it's so expensive, and they can't get enough out of the tree. The essential oil that comes out of here is very, very tiny. And so it's not really enough to produce. So if you do find Dalzelli essential oil, you will see that the price is ridiculous. Boswellic Acid has 16.3% in the resin, Sacra 15.2, Paparia 12.9, Serrata 13, Neglecta 9.8, Rivea only 0.1, and Boswellia fariana has basically nothing. So, but this was done on resin. It was not done on any powder. No powder was made. It was not done on any of the biomass. It was actually they actually took the resin and did it. Okay, so now we could get to back to this. So how do you use it? Well, you can use it in a lotion, and I put it in a simple lotion that looks just like this. And how we put it, how I figured it all out, and it was all through testing, is that in the 35% BA raw, it's 1 teaspoon of powder. This is how strong it is, to 4 ounces of a simple hand and body lotion. You mix it up, let it sit, and then that's it. For a carrier oil, it's 1 teaspoon of powder to 6 ounces of a carrier oil, and in that you have to strain it. You want to shake the jar, but you also put, it's still sticky, so you definitely want to put stuff on top. You want to put plastic on top because you're not going to be able to open the jar. In the 70% Qatari, it is 1/2 teaspoon to 6 ounces of carrier oil and 4 ounces of hand lotion. And as I said before, there is no straining. It just completely mixes up in whatever carrier oil you use. We also can you can also put it in a vegetable capsule. And here it is in capsules. You can buy the capsules actually on Amazon, and in the capsule, you can buy a capsule machine, or it's 1/8 of a teaspoon is what's equal to it. A client of mine said, I can't swallow a pill. What do I do? So I said, you can take 1/8 of a teaspoon. They sell these tiny teaspoons on Amazon also, and you can mix it in honey and then swallow it and take it with a full glass of water. That is basically how we make it, how you can use it. The BA powder was given to several testers in different forms over a 6-month period. These tests that were done were done on first time being done on humans. Most of the tests that have been done have been in vitro. And also the problem is we have no long-term studies. Since it was only done 6 months ago, we're still testing and people are still giving me results back so I can see if certain things go away or come back. The BA extract, as Kevin has told you, has anti-inflammatory properties. It's great in any type of cosmetic products and blends beautifully in lotions and carrier oils. I found it excellent for chronic pain, especially those who have arthritis, stenosis, as well as fibromyalgia. It also is good for dermatitis, eczema, and any type of skin conditions, and in some cases ingested. Somebody else has their microphone on. Can they please mute it? Because it's in the back, it's coming up in the background. As I said, what is it basically used for? The 35% is good for Qatari, is good for those that have sensitive skin, children, seniors, and the elderly. The 70% Qatari is good for acute pain or acute anything all over your body and is not recommended for children under the age of 16 years old. The B sacra is good for the Boswellic sacra. BA extract powder is good for pains in muscles and joints. Both can be used on animals, providing you use an edible carrier oil. So if the animal licks it, it does not get sick from the carrier oil. Oy, oy, oy. So these are some of the test results that we got back. We had someone who had very bad dermatitis on his elbows. He used the lotion, as you see here, and he applied it 2 times a day on his elbows. And after a few days, the adhesion started to stop itching. After a week, the pain was almost gone, and 2 weeks later, he had no more dermatitis. This was a very interesting study. This was on a client who also has been testing for me. If you notice on the left, she has all these wrinkles. And she's been using all kinds of stuff on her chest and she can't get rid of the wrinkles. So she used the Boswellic extract in the 70% in a jojoba and massaged it on her chest 3 times a day. This is what happened 3 months later. It completely dissolved the wrinkles. So it's amazing what this can do. This one also used Boswellic BA extra at 70%. These lesions were on her neck, and after a month, almost all of them were gone. Look at the difference between the two. Almost all of them were completely gone, and she's still testing for me, and she told me at this point it's gone. They're all gone. It also helps, as I said, taking it in a capsule. We use the Sacra in a 0-0 capsule, doing it twice a day. The person had bad rheumatoid arthritis all over her body. She tried everything. She couldn't get anything to work. She used the capsule twice a day. And I tell people to start off once a day to start, because unfortunately, frankincense can give you an upset stomach or diarrhea. So you don't want to overdo, because if you overdo, you're causing more damage than not. So we start with once a day. And once a day for a week, no problems, you could go to twice a day. After twice a day, within a week, she started to have less pain in her hands and and she has arthritis in her knees, and it was amazing what it basically did for her. Now, Kevin also talked about animals. So I had a client who had a 15-year-old German Shepherd named Duke, and he had very bad pain right here. This happens to be Duke on his right leg, on his hind leg. So my client came to me and said, "What can you do?" And I said, let's try the Boswellic acid Qatari on him. And she said, "But what do I do? He licks." Well, we used olive oil. We used light cold pressed olive oil. I mixed it up, and she put it on his hip. Well, after 2 days, he stopped limping, and he could walk without any pain. And it was so funny because she used to tell me that when he felt he needed it, he would go to the counter and grab the jar and bring it to her and put it in her lap. And as if to say, "Mommy, I need it now. Can you put it on me?" And she would put it on him. Unfortunately, he was very old, and he died about a year later, which was about 6 months ago. So, but I was able to get this picture while he was alive and feeling a bit better. There was another case where it was in a horse. He was a horse owned by one of my clients. She worked with him. He was in jumping competitions, and his hindquarters seemed to bother him. The first thing I asked is, "Can he reach where it hurts?" And she said no. So she said she didn't want to give him any type of conventional medicine because it affects him to the point where he can't jump. So we put it in a hoba, and we put it on his hindquarters, and she used it 2 times a day. And after 1 day, he was moving much better, and she's still using it now on occasion when he needs it. So in conclusion, there are no long-term studies yet. As we said, we are testing it. In fact, there's some people here that are in the group that are here online with us now that are still testing it. I've been testing it on 20 different people. I have tested more testimonials. If I gave them all to you tonight, we'd be here till 2:00 in the morning. But I do have it in a PDF. And if you purchase I'm selling the Sacra, and I'm selling the BA in 35% and in 70%. And if you are a business, you could go to my contact page and give me all your information, and I'll give you pricing on how much it is wholesale. So right now I'm doing, the percentage of BA can change on and off depending on what the climate is. And I'm working with a company, as I said, called Dutch Essentials BV. They're based in the Netherlands. You can look them up. And we're partnered up to produce the powder so that it can be sold all over the world. This is the powder for retail. It is the site where I have both the 35% and 70% BA. And that's basically it. So let me undo the share. Whoops. And at this point, we could open it up to questions. I need you to raise your hand so that I can call out your name and then I can unmute and then you can unmute. Hello, anybody? Come on. No, you didn't learn everything. Roxanne. Let's do Roxanne first.
It's Roseanne, but hi. Wait, so I'm trying to, I don't know, I'm not used to this. Okay. If you
I
can see
hear
me.
you.
Okay, you can hear. Okay, that's good enough. All right. So I wanted, there's two questions I have.
Wait,
One
before
is,
you ask the questions, please make sure everybody else is muted. Otherwise, it echoes. Thank you. All right, go ahead, ask.
okay, oh, I think you can see me now because I can see myself.
Yes, I
So,
see you.
hi, Robin. So I wanted to ask about, Dr. Kevin, so you did some of the, showed some of the studies. I was just curious on some of the arthritis studies and what species of Boswellia were they using?
You need to
You're-
unmute. You need to unmute, Kevin.
Okay. Well, in the beginning, I used Sereta, but the problem at that time was that from the vendor, I get some beautiful products. But later on, I found that the products were adulterated with some sand. And then I said, no, I'm not going to use Sereta anymore. And that's why I follow up with the Somali products. That is, the one from Somali is a Qatari. Yeah.
And
They're
I,
more,
I
they're
will
more expensive.
I will give you more on that also. Serrata was the first thing that you see. Serrata is what you see in the stores. And let me explain a little bit about Serrata because I bought the Serrata and opened it up and had it tested. Most of what's in those capsules are fillers. They don't put pure Serrata in there. They put all types of fillers because it's cheaper. Serrata also grows everywhere in India, and it's used in the pharmaceutical companies now or the herbal companies because it's very cheap. And because they could put fillers in it, they don't have to tell you that there are fillers in it. All they have to do is tell you there's Boswellia extract in it. Also, if you looked at the chart of how much Serrata has in it to begin with, it doesn't have a lot of Boswellic acid. They are using a alcohol extraction when they call it and say it's 60%. It's only 60% when they're pulling it out with an extraction, but you're still not getting the full 60%. You're getting fillers in those capsules. And that's why I did not want to do my research and do anything with people on something that wasn't pure. The Qatari that we're using is first grade Qatari. It's the highest grade of all grades. It grows in the Puntland area of Somalia, where the soil is extremely rich. Most companies that you buy your essential oil from are giving you second grade Qatari. And how you can figure this out is the alpha pinene in the essential oil, when they use second grade, is between 20 and 35%. Anything higher than 35, between 35 and 45%, they're using first grade Qatari. Because when they use it with the bark, you're losing a lot of the substance that makes the essential oil because it's being distilled, and most of the time it's hydrodistilled resin, not steam distilled. So what happens is with the bark, you lose a lot. When you get first grade, it's a heck of a difference. I sell first grade Qatari, and I used before I knew all this, I bought second grade Qatari, and I still had second grade Qatari in my refrigerator. So I smelled the two, and I said, "Wait a minute, the first grade smells way better than the second grade." And then once I got into the business, I realized what was going on here is that most companies use second grade, and that's why it's less expensive than first grade. There's only two companies, believe it or not, that are using first grade besides me. That's distilling first grade. And believe it or not, it's doTERRA and Young Living. As much as I don't like these two companies, they are the only, and I don't like them because of their safety problems. But they are actually, because I know where they're purchasing their oils from, and they are actually buying first grade. That's another reason why their oil is more expensive than anyone else. Most people don't know that because they don't sell it. So unless you sell it, you don't know the ins and outs of the essential oil of frankincense. But getting back to the Boswellic acid, this is first grade resin. It's the pure resin without the bark. So you get something totally different. Does that answer you?
Yes, Robin, yes, great. That was amazing. I also want to ask you two more questions, if I may.
Sure.
So one is everything, so the Sacra and Carteri are all, you can take them all internally. It's not a problem.
Correct.
So, and you could take this extract internally.
Yes.
So, and the other question I have is that just curiously, so I have a lot of resins, you know, first grade Hojari and Qatari, and how is this different than the extract that you're talking about?
Because what's in the resin itself, in the slides that I had up, the first slide that I had up that showed the breast cancer one, that the resin contains all other chemicals, just like the essential oil has about 100 different chemicals in it, so does the resin. But the boswellic acid is the only thing that is in this powder. It stays completely behind in the biomass after the distillation of the resin. It sits at the bottom, and that gook that I showed you in that picture, that's it. And then it's dried. And once it's dried, then we're taking it a second step and putting an ethanol organic, because I insisted that it be organic, an organic ethanol solvent to that powder, which now brings out even more of the BA out of it. So when it first comes out of the still, it's 35% in the Qatari. And that could vary because if there is a climate change in the country, like in Oman right now, the percentage of BA is lesser because they have very bad monsoon weather and worse than they have had in years. And the percentage of the BA has gone down because the trees are being stressed from all this resin. So it can change, it can go higher and lower, just like the essential oils, alpha-pinene can go higher and lower.
So to clarify, so the first BA is the 35% that you get right away, and then you extract it with the alcohol and get the 70%.
Correct.
So that's the Qatari. Do you do the same thing with the Sacra?
No, the Sacra, we found that when we tried to extract it, it became very gel-like and it just didn't work properly. Believe it or not, it's the same tree. The problem is one grows in Oman, one grows in Somalia. Totally different climate, totally different soil. So the trees look alike, but they produce totally different resin. and totally different color resin. So that is a factor. And Qatari is not as hard as Sacra is. Sacra is hard as a rock, and Qatari is more of a softer resin. So there's a difference between it. So when we tried putting the ethanol solvent to the Sacra, first of all, the smell was disgusting. So I wasn't going to sell something that smelled horrible. And it just didn't work right in the lotion, and it bubbled up in the carrier oil.
Interesting. So you only sell 35% Sacra then, the first.
Yes.
So one last thing, I'm sorry to take up your time. So the last thing I wanted to ask you is, so the Sacra is used for mostly for the arthritis and pain,
No,
while the Qatari is used for skin?
let me back up. I originally did Qatari first, years ago, and we found it was great for everything. Unfortunately, COVID came, and the company that I was working with, the main owner died of COVID, and the business went under. So I've been searching for somebody to redo the Qatari. It's a very hard process because it takes 2 weeks to completely dry. You have to get all the moisture out of it, otherwise it creates mold. So it really has to be dried correctly. So it takes time. Nobody wanted to do it with me. So what happened is I found a company that was willing in Oman to do the Sacra with me. So we started with the Sacra, but I found that the Sacra really did not work cosmetically on the body. It worked more for muscle and joint pain versus Qatari. Now, when we went back into the Qatari, when I found this Dutch company and we went back into the Qatari, he's a biochemist. So he played with it even more, did the 70%, and we found that the 70% works very similar to the Sacra. It actually helps with pain and an inflammation in the joints because it's 70%, so it's double the strength. And you use very little, because if you use too much, it burns. But the Sacra still does work for muscle and joint pain. It's a matter of which one works better for you for muscle and joint. The same thing when I tell people about resins, they ask me, which resin should I get? Well, Sacra might work better for you. Qatari might work better for you. The Galecta might work better for you. Everybody's body is different. And I tell people, buy a little bit of both and see what works. And then when you know what works, then you buy more.
And you can take either one of these species by 1/8 of a teaspoon. It's okay.
The only thing I would not do is we have not done the 70% internally
Okay.
because it's very strong. I would go for the 35% internally.
Okay.
Who
Thank
else?
you.
You're welcome. Who else is raising? Vanessa.
Robin,
What?
oh, well, let me, unmute, okay.
You answered my question already, Robin.
Oh, okay.
Okay,
Oh, before I forget, before you say something, I have a mark on the side of my face, and it comes and goes, and it's a cluster of freckles, and sometimes you're your own punishment. You do everything for everybody and hardly do anything for yourself. So I decided to take the 70% and put it on here, and it lightened. At this point, it is about 60% lighter than it was before. And I've been using it every day. I started it about 2 weeks ago, and I would say it's about 50% lightened, and I'm going to keep using it until it's gone. Wait, Jackie, go ahead, Kevin, what's your
Yeah.
question?
yeah, my question to you is, have you any experience in patients using the raw resin instead of the powder.
You mean the actual raw?
Yeah, the
The
raw.
No, the raw, the regular resin or the BA resin? The BA powder or the resin itself?
The resin itself.
The resin itself is excellent also. I'm not knocking the resin itself because the resin does different things. But the only thing we found is we've put it in powders and we've experimented it that way. But we found for some reason the BA powder worked better,
Yeah.
much better. But the
Because
but the resin itself in carrier oils does work. It really helps you. But if you have acute pain, you're better off getting the BA powder than just regular aches and pains. Then you would infuse the resin in a carrier oil.
yeah,
And if you
you're-
get my book, you can see which resins worked for what.
now this reminds me in the early days how people used the bark of the willow tree for period pains, for fever, you know. What they did in the early years, that's about 2,000 years ago, they peeled the bark out from the white willow tree, they smash it up, they pulverize it, and then they mix it to the food, or they make it into a concoction, and they drink it, you know. So, but raisin is a totally different substance, because it's more like fat soluble instead of a water soluble. So there is a difference in this. And I have been searching for reports whether people really use a resin or not. But so far, all the studies were done on the extracts of the resin, like powder. Yeah.
The Derby said I would assume the BA powder in oil provides more concentration versus frankincense resin oil infusion. Yes, it does, because it's more concentrated and it's one element. It's not the different components of the frankincense resin that you're taking. You're just zoning in on the BA because that's all that's in it. When they do the 70%, what they're basically taking out is the sugars and the dead compounds that mean nothing. And that's how they're getting the 70%. But it's still only BA. That's all that's in it is boswellic acid. There's nothing else in it. So when you're using a resin infusion, you're getting all the other components that are chemical components that are in the resin. So if you are using it for a different reason, then you would infuse the resin. For example, Boswellia neglecta is excellent for any type of anxiety issues. So if you actually infuse it in a carrier oil and you put it over here and you rub it together and then you inhale it, you will calm down and you will sleep like a baby. Neglecta has hardly any BA in it. So you're not using it for the BA component. You're using it for the rest of everything else that's in that resin. So using the resin is good depending on what you need it for. The BA is more for acute type pain or zeroing type pain. Before anything, Jackie asked, can you explain what you meant about if you use too much, it will burn? The 70% is very strong. So one of my testers decided not to listen to my instructions, and she put it in 1 ounce of carrier oil. And she put it on her face, and she had burn marks on her face. And I said, I told you. She said, it's not working. I said, what did you do? She said, oh, I put a teaspoon of the 70% in 1 ounce of a carrier oil. And she said, you know, it really didn't dissolve well. It got more like a paste. Well, you put a teaspoon of it into 1 ounce. You put anything into 1 ounce, you're going to get a paste. I said, and you put that where? I put that on my face. I said, first of all, we don't recommend you putting it all over your face. You can dot it on, if you have acne, you can put little dots on it, but you cannot put it all over your face. It's too strong. Besides the fact, you put in 1 ounce, it's going to burn. And that's what it did. It burned. So I said to her, wait about a week. Don't use it that way. She still had more of it. Put a half a teaspoon in 6 ounces of carrier oil. And all she was doing was a mole that was right here. So I said, why'd you put it all over your face anyway? So she said, I don't know. I thought maybe it would make my face feel great. Oh, yeah. It made her face feel red. So after a week, everything calmed down. I told her, take a Q-tip and just dot it on where the problem is. And she did it that way and it didn't burn. So
Robin, can you just say what you used for your freckles? Was it Sakura or Katari powder?
Katari.
Katari, okay.
Katari, I actually, for me, I put it in a roller bottle. And then all I did was roll it right on. That was it. Instead of using my fingers, because I didn't know if my fingers were clean enough, I did it that way, right on here. And that's what I did. Or you can use a Q-tip. You should never use your fingers unless you wash your hands very well, because then your hands are dirty. They're not, whatever you touch, they're now dirty. So if you put it on your face, you're creating more of a problem. Anybody else? Shelley. Shelley, your hand is raised.
Hi, Robin. Hi, Kevin. Thank you for the information. I have a question. Like we were talking about the AKBA percentage, which has been studied and which has been said that it's the most anti-inflammatory. So how do we like decide on the Boswellia, the BA of Sacra and BA of Carteri? Is the percentage different or it's the same for both of them?
Well, in all the resins obtained from different Boswellia trees, the active compound is the same. It's the AKBA. That is whether it is Catari, Serrata,
Correct.
the component is the same thing. Just like aspirin. You can get aspirin from the bark of the willow tree. You can get aspirin also from vegetables. But the salicylic acid is basically the same.
Okay.
It's just basically how it works on you. We find that Katari works better on those, is stronger on those that need it cosmetically wise. Eczema, dermatitis. I found it works better on fibromyalgia than Sacra. And this is by testers telling me what they tried it on. And so the feedback that I got back was, I tried the Sacra on my fibromyalgia, it didn't work. So I switched to the Katari and I found that worked better.
You see,
Which one did you use? I used the 70%. That's the difference.
See, here the problem is that we are not dealing with pure substance. We are dealing with a mixture. For example, if your Katari works better because it may contain some water-soluble chemicals like flavonoids. Flavonoid is a good anti-inflammatory agent too, but the concentration varies from the one geographical area to another. So the
Right.
problem is that we have yet to standardize. The word is to standardize, all the stuff that you use.
So I did the 70%. I did experiment a bit. I'm trying on my mole over here. So it's been 3 weeks. So I'm going to wait. But I put it in castor oil. hexane-free
Okay.
castor oil, and it dissolved completely. I mean, it was, and then I put it, I have a little elbow pain, and when I put it on it with the castor oil, I can actually feel something happening, and it's helping me a lot.
So
So
Amazing, isn't it? Totally
Yeah.
amazing.
here
it
the
is,
thing is that if you want to use a carrier oil, you have to understand what is their absorption onto the top layer of skin, how much of it is absorbed in the epidermis, the dermis, and hypodermis. Then the next question you have to ask yourself, what is the permeability? How much of it permeates down to the sensory fiber? For example, all the sensory fibers are actually very superficial. Some of the sensory fibers just go to the top layer of your epidermis. This is what I come to the conclusion. Pain is actually very superficial. If you go beyond the hypodermis, there's no sensory fiber. Now, sensory fiber eh, has changed. The idea of pain perception and the pain receptors has changed over the years. This is why I came up with a new theory that a lot of essential oils, there's especially like linoleum, what else? Menthol, eugenol, and then piperine. Now, all these bioactive chemicals, they are fat soluble. If you mix them properly, they are very good painkiller, topical painkiller for the surface. Now, I ask old people, I say, if you have a pain, what would you do? I take Tylenol. No. Tylenol has got no anti-inflammatory effect. It's good for fever. It doesn't help you to solve the swelling. In fact, California has already banned the use of Tylenol because Tylenol comes from another chemical called phenacetin. In the olden days, when I was a young doctor doing my emergency work, we give a lot of painkiller called APC. APC means aspirin, phenacetin, and codeine. Now, codeine is a painkiller, but it works up in the brain. You know, your aspirin works at the site of inflammation. Phenacetin actually doesn't do so. Phenacetin was banned. At that time, I was in Australia. We don't know why a lot of patients coming into the hospital with kidney failure. That was the first clue. Then we found that phenacetin actually works, destroy your kidney functions, and that was banned. We don't use it anymore. But out of phenacetin came this paracetamol, and I normally don't give my patients this toxic compounds. I say if you take that, you must say a prayer, and you'll be better off. So, for example, I told her you can die from one bottle of Tylenol as opposed to one bottle of aspirin. I asked her which one you like to die, with aspirin or with Tylenol. Tylenol is a killer. So this is why California banned it, banned a couple of years ago. So all these things, we doctors learn things slowly. We make mistake and then we learn, like aspirin. Now, if you have no heart attack, no risk factors, no high blood pressure, no high cholesterol, and you think that if you take a baby aspirin every day, you are protected from that, the answer is no. They found that if you take the every day one baby aspirin, by the time you reach a fourth year, the risk of cancer is 30% higher than those who don't take it. Now, doctors still don't understand why it is like that, but I've been coming up with a hypothesis, that when you knock off the COX enzyme, the first enzyme, the other pathway become heightened up. So you have a more leukotrienes, and leukotrienes are inflammatory agent. So that perhaps is causing all the problem. And the risk of cancer develops only 4 years after you take the baby aspirin once a day. But I avoided this all along. I had a couple of elderly people who insisted on taking baby aspirin a day. I say, you bleed from the stomach, true enough. At least I took care of 10 patients, old elderly people who take aspirin because they believe, they have a misconception that aspirin is good. Aspirin is no good at all.
Okay, before
Thank
I
you.
forget, another advantage of the BA is that you can mix, you can put in it, once you created a carrier oil out of it, you can actually add a essential oil to it if you want to make it even stronger. So if something's really attacking you to the point of no return, you can add an essential oil to the carrier oil, and the two of them together is like double aspirin, if you want to call it that way. What I did is I took Kababa and I put 3 drops into this jar and into this bottle with the BA, and my husband swears by it. Now, I had given it to him without I did a test on him altogether. He's got bad stenosis. So I gave it to him just with the BA in it.
Is it
And
topical application or oral?
Topical.
Yeah,
I gave it to him with the BA in it, and he said, "Oh, that was very good. It really helps. But I really can use something a little stronger." So I said, "Okay, I'm gonna put the Kababa in it, just 3 drops." Mixed it up, gave it to him, and he said, "That made a little bit more different." So you can mix if you need to. I don't need it. The BA is enough for me. I
What
can
did
put
you add to it? I didn't hear what you added to it. 3 drops of what?
I'll type it so you can see it because I pronounce it wrong anyway.
You're talking about
Yes.
copaiba oil.
Yeah.
I can explain that easily.
Copaiba
Oh.
oil.
Copaiba
No,
is
but it
Brazil.
doesn't matter what it was. I could have put in it eucalyptus. I have a client that makes it with the lotion. In the lotion, she puts the BA and then she puts a few drops of eucalyptus in it. And she uses it on her massage patients because she found the combination of the two made them feel even better. For those that have massive acute pain, and also for those that didn't want to use the 70%, because the 70% is more expensive than the raw. So what she did in the raw, she put in the essential oil and mixed it up, and now she had something a lot more powerful. So when you're working on somebody's body, you might not necessarily want to use 70% because you don't know how that person is going to react to something so strong that you've never worked on before. There's somebody raising their hand, Catherine B.
Hi, Robin. It's Kathleen Boland from Michigan. How you doing?
Okay, how are you doing?
Very well, thank you. You started to address the question that I was going to ask about adding maybe a frankincense essential oil to the lotion with the 70% BA powder.
No, not frankincense essential oil. You don't need to put frankincense in there because it's got frankincense already. You're defeating the purpose.
Okay.
You can put something else in there.
Okay, I didn't know if that would, it's like the frankincense EO would increase the efficacy or not necessary. So it sounds like,
No. Frankincense essential oil is going to do nothing to it.
okay, so add another essential oil like the copaiba
Right,
or,
or something else, that's anti-inflammatory.
okay, got it.
I don't see her here. Is Vanessa still here? Or she fell off?
I don't see her.
I don't see her. Vanessa was one of my test students, and she had a mole. She had a bump here and a mole in the back of her head. The bump is almost completely gone, and the mole was about that big, and now it's like this, like the size of a, I don't know, really, really tiny. But it was big. It was about that big, and now it's almost completely shrunk. You have to really push a hair away to see it. So that's how she used it.
Was she
So-
using the 70% or the
70%.
Okay. Thank you.
Anybody else? Any other questions? Before arnica infused carrier oil with perhaps a small amount of cloves or allspice oil would be very effective. That's also good. You can put, that's a good answer, Zach. You can put arnica in it. There's so many different things you could put in it. One of our tests is, and I'll give you an example, and I'm not saying to do this because unfortunately, we don't know if the cancer is going to come back. I had a client that came to me and she said, I want to be a tester. And I said, what do you want to test it on? I have second stage breast cancer. I have a tumor in my breast, in my left breast, and I do not want to do chemo or radiation. And I said, why? Because it could grow. And she said, I want to try something natural first. And I did some research on the Boswellic acid, and I looked at all the studies you provided on your website, and I want to try it. So I said to her, if you do this, it's at your own risk, because I don't know if it's going to get rid of it. I don't know if it's going to come back. I don't know if it's going to metastasize into another part of your body. So I said, so she said, well, give me a protocol. So I said, once a day for a week to make sure you don't have diarrhea from it, and then do it twice a day, once in the morning, once at night, with a full glass of water to make sure you push it down. Warm water, not cold. So she said, okay. So 3 months later, and I forgot about her. 3 months later, she calls me up. She said, Robin, sit down. I said, why? She said, you need to sit down for this. So I said, okay, what's up? She said, there's no tumor. What do you mean there's no tumor? She said, it's gone. That's impossible. How is it gone? Did you go to radiation? Did you use something else? And she said, no, I did your protocol and it's not there. I said, and who told you it's not there? We did a mammography and an ultrasound because my doctor thinks I'm totally nuts, and it's gone. And I said, well, you need to monitor it because we don't know if it's going to come back. I said, every 3 months, you should be talking to your doctor and you should get yourself, because you're not on anything but this, you should go for another mammography. So she at least listened to me, and 3 months later, it's still gone. It is a year later. It did not, she's still being seen by her doctor. He's like, he can't believe it. So I'm working with him also, but he can't believe it. And it's not there. Now, will it come back in a year or two? We don't know. She's still taking the protocol, but she cut it back a little bit to once a day instead of twice a day.
This is the 35% BA?
This was the BA Sacra 35%. That's what she used.
How much
So-
was she taking twice a day? Was it like a teaspoon or?
No, it was a 0-0 capsule.
Oh, okay.
She was doing a 0-0 capsule, filling the capsule all the way up.
Okay.
What is the weight of the one capsule?
1/8 of a teaspoon is
One
a
teaspoon is
0-0
about-
capsule.
Okay.
I
It's a-
researched it. What is in a 0-0 capsule,
Hmm.
all filled up, and it's 1/8 of a teaspoon.
Wow.
You could actually buy these teaspoons. They sell them on Amazon. to put in capsules.
Mhm.
They're very, very tiny, so you can, if you don't want to get the machine, you can actually physically put them in. My husband is using this Sacra for his stenosis. He's using the Qatari topically, but he's using the Sacra, he's taking it internally. And he finds that he can walk. So, as I said, for different strengths, for different items, he found that the Qatari 35% really didn't work on his pain internally. On the piece that he was trying to fix, he found that the Sacra worked better. But on other things, he found that the Qatari worked better. So when he does something stupid and lifts something up, he uses the Qatari 70% on his back, and he finds that that works. So it's trial and error. So you never know which one is going to work for you until you try. But we do know that the 70% definitely works better on skin conditions. And so does the 35% works better on any type of skin conditions. I use the 35% Qatari on a 3-month-old baby. The mother was drinking milk, didn't realize that the baby was allergic to milk. So he developed an incredible rash. They had to keep him naked. You know what it's like keeping a little boy naked? Not easy. And he was so badly rashed up that the medicine that the doctors gave, the pediatrician gave him, was not working. So she said, I need something because nothing's working. So I sent her, I made it special because I made the 35% BA, but I made it less strong because it's for an infant. So I didn't want to take the chance. So I did a half of a teaspoon in 4 ounces of a hand and body unscented lotion. She applied it to his genitals. Within a day, you could see the redness go down. And within 3 days, it was almost completely healed. And by a week, it was gone. So it's amazing what it can do, whether you get the 35% or the 70%, depending on what you need it for. Zach, you're raising your hand.
Yes, I am. Just first of all, thank you both. This has been an incredible webinar. Really learned a lot. And my question is really, I understand that your Boswellic acid extract is to extract just the boswellic acids, but would it be potentially beneficial to add some of the raw resin back into a lotion blend or something like that?
You can use the regular lotion and do it. The
Okay.
BA, as I said, is more for acute problems, where the regular resin is not so much for acute, but it's good for regular aches and pains. It can be used for arthritis. Boswellic Fariana is excellent for arthritis if you make it in a safe or in an infusion. But if you need something to go deeper for the pain, then you would use the BA. And you can use both of them. You can take the resin infusion and mix it with the BA infusion. And now you've got something even stronger, and do it that way.
That makes a lot of sense. Wow, thank you. And Kevin, I did have one small question for you.
Go ahead.
I was just wondering, where can I find more information about your capsaicin research?
Oh, do you subscribe to LinkedIn? That is the only platform that I use, LinkedIn. And you can go into slideshare.net. These are the two. And then next one is a ResearchGate, I think. So most of my lectures were posted onto the LinkedIn.
On LinkedIn. If you type in his name, then you can click follow and you can follow him. And then everything he posts, I'm also on LinkedIn. But if you type in his name,
Yeah, Google under my name.
right, Google his name, you should see it.
It's just a Kevin, KFNG. If you type in Kevin in, there are 3,000 Kevin in. So you get lost. So I put in my middle in Chinese name, Kevin, K for King, F is for France. And
He's
then
got
N.
he's got a lot of great articles under him. So you could sit there reading forever. Believe me, I have. He's got great research. And me, you can find me on my website. You can contact me and ask me any questions. You can go to robinsresinsplus.com. That's where I have the BA for sale. And also on there is a contact if you're a business where I can give it to you. I can give you the wholesale price of both of them, of all three of them. So, anybody else, or I'm gonna stop?
I have a quick question. So you
Sure.
mentioned take the powder and you can put it in the carrier oil for 2 weeks, but can you just like heat it like in an
No,
hour?
that's only the sacra. For the sacra, you need to put it in for 2 weeks, just to get it to dissolve into the carrier oil better. For the Qatari, you also need the regular. You also need to put it in. We put it in for about a week because it's finer than the sacra. So, but the 70%, there's nothing. It just dissolves, completely dissolves. So there's no reason to strain it at all. With the other two, you have to you can't strain it in a coffee filter because it's too thick. So you have to strain it either in cheesecloth or in a coffee press. And even if you leave a little bit of the BA in there, there's no harm. I have testers who didn't strain it at all. They like leaving it in the raw. They just liked it. When it's in the lotion like this, the Qatari is a little grainy and so is the sacra. In a lotion, it dissolves differently. And what you could do is what I do every night is I put it on my face. I let it sit there for about, I would say about a minute, and then I use a cotton ball and just pull it off. And you should see the dirt that comes off my face. And I don't even have the stuff that I'm using. You don't even have to wash it off. So I sell it on my website too. But you can also, it makes a great exfoliant. It really does. And I found this purple clay, and which is very good for a face mask. So I mixed the BA and I took a half a teaspoon of the purple clay and mixed that in it, and that I put on my face. So now I have an extra plus. So when I take it off, my face feels even better. So there's so many different things you can mix in it, to experiment with it.
Thank you.
Anybody else? Zach.
Oh, I was just doing the hands clapping. Just thank you again. What an incredible presentation. And I didn't know that you did these every month, you said?
What? No. Where did, no. What I do every month is I am board trustee on IFPA, and I hold lectures monthly there. That's what we were talking about in the beginning when Kevin asked me if I do webinars. Well, I do it through them. But if you go, you can email me anytime, anytime. Or if you're on Facebook, you can, through my business website, you can text me questions. I always answer. Somebody just raised their hand. Lady.
I just wanted to say thank you. It was a pleasure and an honor, Robin. Dr. Ng, you said that you worked on ACE inhibitors.
Yeah.
I'm a nurse or a nurse practitioner. So that just sparked my mind. I'm like, oh my God, this is like pharmacology royalty that I'm listening to right now. Robin, I learned a lot tonight as well. So I just wanted to say thank you.
Thank you.
Thank
Yeah, we
you.
worked together to put this whole thing together. So,
Yeah, this is pretty awesome. And I can't believe it's actually free. So
yeah, we made this
Yeah.
free. That's why somebody asked me if we would send a PDF of this.
yes.
Kevin and I are gonna talk because
Okay.
I think we'll put he'll send me the PDF, I'll put it all together and then copyright it. And we haven't decided yet, but we're not gonna give this free. It was too much work to give free. The webinar we're giving free. But if you want a copy of it, email me. And
Okay.
in the next couple of days, Kevin and I will be talking anyway, and we'll come up with a price for the PDF.
Awesome.
Because I wanna lock it and make it copywritten. Elizabeth,
And then just put Dr. Kevin information in there also when we get the PDF files,
I will give you the his information.
because this was amazing. Oh my God, what a lot of knowledge tonight.
Yes,
Thank
he
you.
is. I tell him every day, you're a walking encyclopedia. That's what he is.
A supercomputer.
He will talk to me, tell you.
Supercomputer brain.
He'll talk to me for hours, and my husband says, "Oh my God, how could you guys talk so much?" So, but
Amazing.
it's amazing. He is. He's
Yeah, you're lucky, Robin.
Thank you,
All
Dr.
to-
Kevin. This was great.
Yeah, very good. Altogether, 45 years of hard work inside, you know.
yeah.
But imagine, it took aspirin 2,000 years before.
Oh,
It-
by the way, one thing he came up with, which he and I forgot to tell you, that if you do it internally, and how we came up with an interesting formula of how to do it. If you take 2 ounces of the powder and 1 teaspoon of black pepper, grounded up black pepper, and mix it together, your body will be able to absorb the BA better. I forgot to put that in the slide.
This applies to turmeric as well. The active ingredient in turmeric is curcumin. If you take curcumin, absorption is almost negligible. So when the clinical result came out just about 3 years ago, all the nutraceutical companies now add a small dose of black pepper extract inside. So otherwise, you spend all the money on the turmeric, and you don't absorb the curcumin. So it was a waste of time, you know. So now science is coming in, and then the other method of better absorption or better bioavailability, bioavailability. Oh my God, bioavailability is to mix this active ingredient into so-called nanoparticles. Now, some companies are spending a lot of time in this formulation. A lot of things that we could not, we found it doesn't absorb. Will open a totally new era in the years to come. Like for example, we found that the grapeseed extract in early years, we don't understand why some patients take grapeseed extract plus a high blood pressure pill, they fainted. They fainted, and then now we know that the grape seed extract enhance the absorption of some medications.
Dr. Kevin, I want to ask you a question. We know that turmeric is fat soluble. So is that the same with frankincense, with Boswellia? Is it also fat soluble?
Yes, frankincense is fat soluble. It's not water soluble. The
No,
boswellic acid is not water soluble. It is
No, the boswellic acid is fat soluble.
It's fat
absorbed.
soluble.
It's absorbed in the same way as any oil, any vegetable oil that you use. Whether
If you put it in water, it'll float on top. It's not water soluble. It's definitely fat soluble. That's why it mixes in the carrier oils, because the carrier oils are fat soluble.
Right. So that increases digestion. So with turmeric, if you take it in a fat, you'll absorb it better than just taking the capsule by itself. So if you take a boswellic acid in a capsule, you might want to have something with fat in it to help the absorption. So
definitely.
You could do it that way too. Or if you can figure out how to mix the oil into the capsule, which is hard, you can do it that's why they tell you to take a vegetable capsule, a vegetable 00 capsule, because it's got the fatty acids in the vegetable capsule, which will help. And if you put the pepper in it, it's got to be black pepper, and you can find black pepper extract in any supermarket. So
what about, I just had a thought, if you're making an oil, instead of using jojoba oil, you can use olive oil.
yes, and then
you
can do it that way.
internally.
Right.
Yeah.
Yeah, as long as you don't take too much, because olive oil can lead to diarrhea. So, because you're putting oil into your body. So a little bit is not going to kill you, but a lot of it could make you sick.
Well, that's what they do with cannabis oil. They'll put it in like an olive oil, and then they sell it. And you could take a drop, so you could take a dropper full. So that might be almost an eighth. You could figure out how much an eighth of a teaspoon is in an oil.
Jackie asked, does it matter if the capsules are enteric coated? Is it? I don't know. Is it a problem?
Enteric means it just covers everything until it gets
Down.
into the intestines.
So
Yes.
so I'm assuming yes, it would, because if it's encoded and you're taking a fatty acid like the olive oil to get it down so it goes down correctly, then you shouldn't have a problem.
Well, the purpose of using an enteric coated capsule is to prevent the capsule from dissolving in the stomach. That's the main thing. Like, for example, aspirin. A lot of people develop stomach upset when they take aspirin. So they did to take what was enteric coated. The way they do it is to bypass the stomach so that it can be absorbed easily in the intestine. Now, salicylic acid is very well absorbed in the stomach by itself, but then it causes peptic ulcer. And to avoid that, the drug companies add something inside and make it enteric coated.
One question, and I can answer that right now. Is it applicable to put black pepper essential oil? No. Essential oil is too highly concentrated to swallow. So you want the actual herb of black pepper extract, not the essential oil, because then you can create more problems than you know what to do with.
Right. Thank you. Can I ask just one more thing? Like when we have made the infusion of the Boswellia, the extract, the BA extract, if we put in 1 drop of black pepper, like we put copaiba, do you think it's going to enhance, or it's still?
It will enhance topically, but I would not swallow it.
Yeah, that I get it. Right. Thank you. Thank you.
Yeah, black pepper has a lot of activities. Part of it is due to the presence of beta caryophyllene, which is found in high concentrations in the copaiba essential oil. So on top of this piperine, you have flavonoids. The flavonoids are also anti-inflammatory. So if you use the black pepper extract, you have several components that act synergistically and not by itself.
Zach asks, is the effect of the liver that helps absorption? Is it the effect of on the liver that helps absorption?
Well, what the liver does is that whatever you take in by mouth is absorbed through the small intestine, go into the portal artery, then gets into the liver. That is what we call the first bypass effect. In most cases, the liver chew up about 50% of what goes through it. What comes out from the other end or the portal vein is about 50% of what you put in. So like people like who are lacking enzyme to break down the alcohol, like myself, I cannot take it. I take a small, even 1 tablespoon of beer or wine, my face will flush out because the liver cannot break up the alcohol. So a lot of it goes into and hit on my nose. So I look like a lobster. Now, like my wife is different. She has the enzyme in the liver. She can take the whole thing as I want to take it, but she never feel anything at all. So that is due to the, genetically, she has an enzyme located in the liver that chew up the alcohol that you put in. So she will never get drunk. But I get drunk so easily that I cannot touch any alcohol at all.
And Zach,
It's a blessing. It's a blessing that I cannot drink.
Zach, you have a question?
Yeah, that pretty much answered it. So when you take black pepper as a temporary measure, I think that that's a great way to increase the absorption of something. But I've heard that there are some long-term effects that are maybe not desirable, particularly on the liver, because it messes with the liver enzymes. Are there other methods to aid the absorption?
The black pepper, is a spice used for thousands of years. On every table you see salt and pepper, salt and pepper. That's how I was curious about it. Why people take salt and pepper? Black pepper extract is a flavoring agent. At the same time, it has a lot of properties unknown to a lot of the public. For example, it is a hell of a powerful antioxidant, hell of a powerful anti-inflammatory agent, just like boswellic acid. And in vitro or under tested conditions, it also cytotoxic. In other words, it also kills the cancer cells. So a lot of research has been done on it. But unfortunately, the pharmaceutical company do not invest on this because they cannot patent anything that comes out of it. Just like when my mentor and I found that aspirin could prevent blood clots, and also reduce inflammation. We tried to patent it in England. All the lawyers in all the 3 companies say that you cannot patent anything that is natural because that belongs to everybody. You cannot do it. But on the other, when I found the ACE inhibitors from the snake venom, my mentor brought it over to America to Script Company and told them that we have some fundamental information. We would like you to go for further research into that. So there was a board in the Script Company that oversee what sort of research they need to do. There were out of 7 professors of medicine, 6 voted no, and 1 said yes. So they hired 2 biochemists, and these 2 biochemists break up all the peptide, all the amino acids from the snake venom. They synthesize it the first synthetic ACE inhibitor cannot be absorbed by mouth because they were peptides. So they changed the molecule and add in a sulfur molecule inside. That was the first Capoten. And then from then on, you got 10 other ACE inhibitors. Now it is still the #1 drug for people with congestive heart failure.
All
So-
right, because, wait, stop a minute, because I want to stop the recording. Otherwise, it's going to get too big because it's at 3 hours and 4 minutes. But you can still ask your questions. But what I'm going to do is everybody stay where they are. I'm going to say thank you, Kevin, for working with me. And thank you, everybody, for coming. It will go up on YouTube tomorrow because there's no way I'm doing it tonight. And if you want the PDF of it, please email me. Give Kevin and I a chance to put it all together. So I'm going to just stop the recording as soon as I can figure it out. Okay.